be a little bit better now. All right, I'm just gonna hook up my headphones and we'll be off the races. Were you in the, were you in the were you...
Can't hear you.
Can you hear me now?
Yep.
Perfect. Were you in the operating room today?
I was.
What did you have?
A couple little cases, a glomus tumor of the hand, which was just perfectly classic glomus, you know, really tiny, super painful. Made the incision, and then there was this like little blue pearl staring at us.
Oh, that's interesting.
It was a super fun teaching case, and then we had a really awesome synovial sarcoma of the forearm that was plastered against the ulnar neurovascular bundle, and so you know tumor surgeons like doing that stuff.
Right. Just like peel away and dissect it all out and everything like that. That's wonderful.
And we made someone cancer free today, so
that's awesome.
Good. Yeah.
How do those glomus tumors actually do in general, like after they get resected?
Totally fine. Recurrence rate is low, and then they are among the happiest people because they hurt, right? Not many soft tissue tumors are painful, but glomus tumors are, and so as soon as, and this was in like the palm of a woman's hand, in her dominant hand, so a little bit of an unusual location. They're usually more in the fingers, but but it's gone, so she should be pain free.
That's amazing, and obviously just a testament to how wonderful you are. And I want to go ahead and get this episode started because I know it's a Friday night and I don't want to take too much of your time, as it were. And you know, so welcome back, folks, students, residents, faculty who are listening in. I'm Tab Zyer, one of the founders of Ortho Mentor, and I'm really honored to present our next episode of behind the scenes conversations with a program director featuring Dr. Tessa Balach from University of Chicago, where she is the residency director in the Department of Orthopedics. Dr. Balach actually did her medical education at New York Medical College and then went to residency at University of Chicago. And then she was actually at UConn for some time with one of my good friends and former co-fellows, Dr. Lauren Gainey, who was on just a couple of weeks ago, and has since returned back to University of Chicago, where she is an orthopedic oncologist, doing amazing things, including taking tumors away from nerves and making people pain-free and cancer-free, which is a wonderful thing. So thank you so much for being, here with us tonight. Really appreciate it.
You're welcome. I'm excited to be here and hang out with you guys.
So, well, thank you. I know when everyone's excited. Actually, my student who was in the OR with me today, he's, really interested in University of Chicago and is, I think, looking forward to chiming in. Hopefully he's not too far behind me in terms of getting out of the operating room. First question I want to ask is, how long have you been PD for? And obviously you've been been in the PD role at a couple different institutions now. This spectrum of institution, and also what have you learned just from having been at at UC as a resident and now as an attending in practice and the program director as well? What kind of lessons have you picked up?
Oh my gosh, so many, because I've been in some sort of educational kind of leadership role for almost 8 of my 10 years of practice, so a long time. I think the most important thing I've learned is that change is constant in education, like it is in so many areas of our lives. But the way we don't want to get stagnant with any of our surgical techniques or anything that we're doing for patients, the same is true in education. So that's actually something that fuels me in my role, is learning about better ways to teach our residents, better ways to do skills training, better ways to optimize experiences inside and out of the operating room, and just make education better, with sort of every month and every year that goes by.
Right. That is actually really wonderful to hear. And I think that you're absolutely right that even in just from last year to this year, obviously a huge amount of change, a lot of different variables in play at this point. What kinds of things have you been sort of involved with? And I'm in part alluding to, Ortho Access and sort of the wonderful things you're doing with that. So tell, folks listening who may not be familiar, hopefully they are, but tell them what you've been doing to sort of combat this sort of like void of not having away rotations and so on, at least from the UC perspective.
Sure. So a year ago, actually, a group of orthopedic educators got together and created a curriculum for 4th-year medical students. I had recognized somewhat before that there was definitely a gap in the education that fourth year medical students were getting while they were on rotation. So you rotate at 3 or 4 or 5 different places. And in a lot of those situations, there's not any teaching directed towards the medical students. Sure, the med students sit in resident conferences and case conferences and stuff like that, but that's not for them, right? Some of those things are chief resident level, fellow level. So we created this curriculum a year ago that was intended to be shared across the country, so that as students rotated around, they could still participate in this curriculum wherever they were. This year with COVID and no rotations, we took that curriculum and we digitized it. And so we created a 15-week educational series that we've been doing live every Wednesday night. It's totally free, easily accessible. And we have over 1,000 students registered for our webinar series. Those who can't, it's pretty amazing.
That's awesome.
Those who can't make it, we have a great website where we post all of the recordings for the webinars. There are some resources there. PDFs of all the slides are there. So it's really just a free educational resource in like the foundations of orthopedic surgery across all of the subspecialties.
That's super awesome, and I'm going to put in a shameless plug because I think I'm involved with the one next week.
You're going to be with us on Wednesday.
So I'm super honored. I'm super excited, and I really wanted to make sure that I, highlighted, how great to have, how great this Ortho Access is. And so someone's asking, if I just noticed, how do you actually get access to it? So is there a website you want to just sort of give out real quick?
There is a website. It's it's a little bit long. Sorry. It's voices.uchicago.edu/orthoaccess. We have we're on Twitter, so at orthoaccessinfo on Twitter, and then there's a link in our Twitter bio to get you to the website. So at orthoaccessinfo on Twitter.
That's great, and I think you're absolutely right. And what it's really kind of unmasking in this particular cycle, just my humble opinion, and I love to get your perspective on it, is how much we take a lot of things for granted. We take for granted in some ways the fact that, hey, we have away rotations from which you can learn by, right? We take for granted that we're going to see people at annual meetings, right? But now we are having to really pivot, and not just in medicine, but across the board, really pivot in terms of how we connect, how we advise, how we mentor, how we educate, just like you're doing. So with that being said, how do you suggest that, prospective students who are interested in UC or otherwise, how do they engage with you in your program? How do you suggest that they engage other programs? Ortho Access is one part of it, but then how do they talk, how do they get to know other programs around as well?
Yeah, I can speak for what we're doing, and I know it's similar to what a lot of the other programs around the country are doing. But certainly attending Q&As that that the residencies are hosting is a great way to get in front of faculty and residents. Many programs are hosting sort of virtual experiences of some sort. We have ours that's, we're in our 2nd month right now that's going. Unfortunately, we filled that a couple of months ago. People are, I know, filling out their web pages to get more robust information there. We have a pretty robust Instagram page that's got a lot of resident and faculty profiles on it, so you can get to learn about who we are as individuals and also clinicians. And then if there are specific questions, like on our website, all of the resident emails are on the website. My email is easily accessible, as our APD and our program coordinator. So just feel free to reach out. I think it's one of those funny years where you just have to kind of take the bull by the horns and ask the questions that you need answers if you can't find them out there.
But so, of course, the bull's by the horn, especially in Chicago. So I mean, that's totally appropriate. I apologize. I keep flipping back and forth. For folks listening, I'm a little discombobulated because I literally just came back from the operating room, as did Dr. Balach, and so I apologize for getting us started late. But also, as I'm waving to everyone, for some reason it keeps flipping me. So my apologies about that. Let me ask you, I think, a question that I consider the white elephant in the room, which is, how and what are you saying as far as what sort of guidance are you giving prospective applicants in terms of what you are looking for? You as a PD, you at the helm of the selection committee, what are y'all looking for at UC in terms of your prospective applicants?
Yeah, I think this is a really, it's a year for a lot of reasons that we're looking at our application review a little bit differently. Um, with USMLE scores kind of going away in the near future, we're trying to get used to not looking at those. We are obviously with no rotations, people have had really different experiences. Our letters are going to look different, stuff like that. So we're going to try to tease out from the application the things that we think makes successful residents in our program. And that's people who take pride in their work, who are excited about the jobs that they're going to do. The usual, right? You have to be smart and hardworking, but beyond that, we want to see like some grit and resilience in, you know, in the face of challenge and adversity. We want to work with people who are going to step up and do the right thing. And, you know, our hospital is in a very diverse part of Chicago. We take care of a very, very diverse patient population. So we want people who are engaged in their community and who want to work with the patients that we take care of. And, you know, people who value communication and professionalism and those who are ready to learn and step up and be awesome orthopedic surgeons.
That sounds amazing. And, you know, I'm not sure I would fit that bill personally, but I'm sure I'm sure there's lots of applicants that, you know, that are out there that certainly would. Are you, you know, have you in the past used step scores as sort of a screening metric? And on the flip side, now that you said, you know, steps going to pass fail, as we know, are you kind of looking at other things in particular when you're looking at the applications this time around in particular?
Yeah, so we did use Step 1 as a screening tool in the past. We get close to 900 applications a year for our 5 spots. We've traditionally done our interviews that weekend right after Thanksgiving, so the turnaround on that is pretty tight. It's really difficult to cull through 800 applications, right, in great detail. Right. So that being said, we're still going to use a little bit of a cuff, but we're lowering it a whole bunch, like way closer to the mean of the USMLE Step 1 with the dropping it completely in the future. But we're going to look more at all that sort of qualitative stuff, right? Like what kind of activities have you been involved in? What sort of research have you done, and how have you connected to that? What do your letters say about who you are as a person, and what does your personal statement say about you as a unique applicant in orthopedics? So I think we're going to look a lot more at those things and do much more holistic review of applications than just kind of like, yep, you got great board scores, you know, you've written 17,000 papers and you've honored everything. Like some of those things that still will be important to us, right? But we're going to look more broadly and spend a lot more time with all the applications, I think, than we have in the past, which is going to be a challenge, but we're really excited about it because I think it's going to open.
Well, that's great to hear, because, you know, obviously the, you know, students are having, you know, questions galore about, you know, some of these metrics and obviously transparency and everything like that. What do you think, at least as far as looking, if you had to look at your current intern class and or maybe the residents that just graduated, right? What would you say are some of those sort of key attributes that you all value at UC in particular?
Yeah, so some of those things I mentioned before, because that's how we came up with that list. We thought a lot about our chief residents. We had a chief class who graduated this year who were they were a fantastic group. And so in addition to some of those things, people who take care of themselves well and take care of those around them well and their patients, you know, the people who are ready to do the right thing sort of regardless of the situation. COVID put a lot of challenging situations in front of all of us, being asked to do things that we weren't necessarily assigned to do or had planned to do. And we saw that those who sort of stepped up to just do the right thing and be part of the team and take care of the patients and take care of each other, that is where we found a lot of value, and we all felt engaged in our purpose as orthopedic surgeons. So those are some of the things that have come to light thanks to COVID, and I think we've been able to articulate clearly.
That's really, you know, that's really excellent to hear. So when the, you know, as a person who didn't match the first time, you know, a question that comes up kind of in light of, you know, those kind of some of those things about grit, resiliency, and so on. How do y'all view reapplicants, and are they kind of viewed with a little bit more of a sort of, a little more scrutiny, or are they looked at in terms of, hey, what have they been doing since they applied last? How much does them not matching sort of weigh in your mind in terms of like as a quote unquote red flag?
Yeah, I think it's a little bit of, they get looked at with a little bit of all of those things, right? So it's, why didn't they match? What happened? Can they identify that? Was it just a fluky, weird thing, which we know happens, right? Or was it someone who didn't pass step 1 the first time around, or who was on academic probation, and, like, are there academic issues, or was it just a fluky, weird thing? And then I think trying to understand what's happened in the year since they didn't match is important, or what they have planned. I mean, it'll only have been 6 months, right, since the last match. So there's not a lot of time to have 17 publications added to your CV. But I think reflecting on that and sharing whatever insights you have as a reapplicant about coming into the process a second time is really helpful to see. And even seeing those things in letters of recommendation will be important to us.
Do you think that that's something that you have to sort of highlight in terms of like your personal statement, or some of these other sort of like more holistically, valuable items this time around in particular? Or do you think it's like, listen, like you don't necessarily need to put a neon sign on, like, or a target on your head that I didn't match, and put that out there? How do you think students should handle that if they have to be prepared to answer that question? You didn't match, so what happened?
Yeah, I think, I mean, they're going to get asked that question, not necessarily by us, but people will ask them. And so I think having something prepared about that and acknowledging that it happened, it's not, like I said, it's a fluky thing. I think a lot of the times when you look at sort of the CV of those who didn't match, they have good research, they've got good grades, like what was it? And I think sharing a little bit of that reflection and some of the insight is important. It's part of the application, right, that's going to come through. And I find it, I enjoy when people can, I don't know, enjoy isn't the right word, but like I appreciate when people say like, yeah, I had this, I think this is what happened, like I'm doing it again because this is my passion and this is what I love. And like, I'll be damned if I'm going to let that stop me. Right. I mean, one of my favorite attendings in all of residency didn't match the first time around. And he's like an amazing guy, is taking care of my family and stuff like that. So it doesn't always correlate, right, to your success in the field.
Right. I mean, I would totally agree with that. I said, and I still remember not matching and sitting on my couch in Philadelphia, and I was watching, and I'm going to admit this live, I was watching High School Musical and on Disney Channel at the time, not sure why, but my roommate came in and I was deciding to scramble, that's what it was called at the time, into an anesthesia spot at Harvard. And one of my roommates came in, he slapped me across the face. He said, "You've been talking about ortho this entire time. Why would you consider doing anything else?" So I think that notion of, being able to figure out, be productive with what you're going to do, what you're doing, and be able to talk about what you've experienced, what you've learned from it is all particularly important. How do you guys evaluate or look at osteopathic students or international medical grads, and how do they sort of follow the application cycle for you guys?
So we in the past have not had a lot of osteopathic applicants to our residency. They have, when we have, they've been screened similarly. Foreign medical grads, because of visa things and stuff like that, we haven't typically looked at closely. Got it. Unless they've had other connections to the program, stuff like that.
Understood. There were two questions that came up earlier, and I want to make sure I get to both of them before we talk about Chicago, the Chicago program specifically. So one was a first-year medical student, MD student, who said, what are some things that you might advise them to do now, kind of if they're interested in orthopedics, especially in light of obviously shadowing restrictions and other things that are obviously limited from a clinical experience perspective?
Yeah, I think it's engaging in whatever virtual experiences that there can be. A lot of it's hard, but it's having conversations. A lot of the residents are super sensitive to everything that's going on. So maybe even reaching out to residents at your home program, if you have a home program, and saying like, hey, can we just chat for 15 minutes about what life in orthopedics is like? Research, which we talk about in a lot of ways, but it's a good way to get to know a little bit about the field. And even with sort of social distancing restrictions, it's possible to get involved in research right now because a lot of stuff can be done remotely. Even if it's a chart review kind of project, it's still a great way to learn a little bit about orthopedics and start to get your feet wet, and figure out that this is what you really love and get to know some people and be productive at the same time.
Right. And, I think that like people often think that, oh, hey, we're just all about research. And, in orthopedics, and I'm sure you would agree with this, orthopedics, there is a lot of research that is how in part we get to from benchtop to bedside. But there's more to just the research component, as you're alluding to. There's the teamwork, there's the analytical skills, there's like your ability to get projects done that really are looked at also. So in your mind, on that note, how important is it that folks have research on their application? And secondly, does it have to be orthopedic research in particular?
My favorite question. I love that question, actually. So I think research in general is important because it talks, like you just said, it's not just about doing research and getting publications for the sake of it. It's about engaging in the science of medicine in a way that opens your brain and your mind to critical thinking, to exploring new ideas, to engaging in the scientific process, to assessment of science and all of those things. That being said, it does not have to be orthopedic research. I mean, many students come to orthopedics late, and to me, it's about follow through and completion of that work, and it's a reflection of some resiliency and persistence, because it's hard to be productive in research as a medical student. And so if you have research in a topic that's not orthopedics, that's totally fine. I think it's important for you to do research in an area that you are engaged in and that you love, because then you will be more inclined to get it done, be productive, and be successful in it. So that could be public health work. It could be community outreach or research about social determinants of health, right? Things that aren't necessarily orthopedic, but that you can somehow tie into your orthopedic journey, should that be the path you take. And if you've got a bunch of ophthalmology research, and as a PGY3 you're like, no way, I don't like eyeballs, I like bones, like, great, tell the story, right? Tell the story of how your life changed from being interested in ophthalmology to orthopedics.
Many of us, I won't say everyone, but many have use the research and the associated authors or whatever as icebreakers, right? Oh, so-and-so. But the interesting thing is that I think the research is sort of like a way to tell a little bit more about, hey, why you got to where you are at that point in time, right? So I've been having the same question about folks filling out ERAS. You really need to think about, especially from an interview perspective, and I'm sure you would agree with this, that how does it relate to what you want to do in your life, right? It doesn't matter whether it was basket weaving, whether it was whatever, building an orphanage, which I'm sure some folks have done, but whatever it is, how does it relate to your interest in in medicine, but also B, in terms of your aspirations becoming whatever you're becoming, right? Orthopedic surgery or otherwise. So I totally agree with that. There was an osteopathic student earlier who's a third year DO student, who asked, are there any things that you would suggest that as a third year DO student that they sort of think about, in terms of obviously the application process and obviously applying to residency in orthopedics?
I mean, I think no different than an allopathic student. The things that are going to make you successful in an allopathic program are going to make you successful in an osteopathic program, and vice versa. One of the really good things about the combined match and combined accreditation that's happening for all of the both osteopathic and allopathic orthopedic programs is that distinction between DO and MD is blurring when people look at applications. So I think, showing that you are the smart, energetic, engaged, dedicated, gritty, resilient, like all those things is going to be important whether you're an MD student or a DO student.
Yeah, I mean, and that's wonderful to hear. And, I ask very similar questions. Doesn't really matter. I think you may need to be a little bit more strategic about things, because many of the osteopathic schools don't necessarily have, high power academic centers or affiliate academic centers, or may not have as much experience in a given field, or experience in a given field. So with that in mind, be sure to not just look at your school, look at those who match from your school and orthopedics or any specialty, look at the folks in the community, look at other institutions locally, and just like Dr. Balach was saying earlier, connect with them to help sort of bolster your interest and application in the ways that she has described. So I really want to take the time to focus on University of Chicago now, because
Sure.
I've heard wonderful things about it. What would you consider are the top sort of three, and one of my former students is your intern right now.
Yeah.
And so I say hello to
our
Dylan
trauma
Texan
rotation
as well.
right
Oh,
now.
is he really? I should text him like right now. What are the three sort of highlights or strengths of the program that you would like consider that really resonate with you in terms of talking about University of Chicago specifically?
So I think a resident-focused education program, our clinical balance, right? The sort of the balance of the clinical educational experience, and the relationship between and amongst residents, faculty, and those two groups together. So we have fellowships in the program. We have 4 fellowships. There are 4 fellows who are on the main campus at any one time. And that being said, the priority educationally is the residents, and that is obviously mine because I'm the residency program director.
Right.
But that's supported by our chairman too. You know, last week somebody, the arthroplasty fellow who was supposed to do a case with me said, "Oh, hey, I know so-and-so resident is supposed to be with Dr. Jones. Like, can I switch? Because Dr. Jones has revision cases and you just have a primary total hip. Can you have the resident and I'll go do that?" And I said, "No, that's the resident's day to be with Dr. Jones, to do the revisions, to learn that stuff. Like, after my primary total hip, you can go be with Dr. Jones along with the resident, right? And sort of second scrub that person." And so that's right. So that speaks to that piece of it. About 2 years ago, speaking of Dylan being on the trauma rotation, we became a level 1 trauma center for the first time in a very, very long time.
Wow, that's amazing.
Yeah, and so trauma had been a big weakness for us. And so now that we've got trauma and we're the busiest level 1 trauma center in the state, we have rounded out all of our sort of clinical subspecialties. We've got great sports, great arthroplasty, spine. We've got 2 new PEDS faculty who joined us this year, right? We've got obviously a robust tumor program with an oncology fellowship that's been very long-standing. And so all of our clinical programs are really nicely built out, and trauma just added right to that. And we've incorporated it in a way that doesn't interfere with elective practices, which is really nice.
That's amazing.
Yeah.
That's absolutely awesome. Actually, someone mentioned that to me earlier today, that you know, about the trauma thing. So that's wonderful to hear. Yeah. How do the residents sort of, is it more, do they get operative experience sort of early on, or is it more sort of like, you know, backloaded when you're a little bit more senior and so on? How does that work at your program?
No, they start doing things early, and so on the interns rotate with us clinically currently on arthroplasty and trauma, and then they do a little bit of night float. And the goal on arthroplasty with one of our more senior faculty is that by the end of their 10-week rotation, that the intern is doing a primary total knee start to finish, right? So, I mean, granted, with help, they're not like flying solo, but that they're doing all of the steps of it, right? So that speaks to the graduated autonomy and like supervised, right, practice that happens on that rotation. Since we've, with trauma coming on a couple of years ago, as the seniors are starting to rotate through more and more and they get super comfortable, like they don't need to do the 100th nail from start to finish. So that stuff all has been trickling down, and even trickling down past the PGY3s down to the PGY1s.
Wow.
The PGY1 on trauma is not like the floor monkey, right? Like that their job is to be in the operating room. We have PAs on the trauma service who run the floor and do that stuff. So I was the floor monkey for a while. Yeah. And that was traditionally sort of the role of the intern on trauma, was like you were the floor guy and that's it. But on the days when they're in the OR, it's a faculty member, a chief resident, and an intern. So when there are straightforward nails and straightforward plates, like what an awesome way to do basic bread and butter orthopedics. And so that is the sort of the template, and that just carries all the way through. I mean, when I'm on call on the weekends, I try to not scrub as many cases as I can. Like I sit in the hallway and I like keep popping my head in for the who are doing cases, but I give them space to you know, to exercise their
struggle,
independence and stuff like
right.
that.
No, that's fantastic. With that being said, especially now that you have a very robust trauma service, what sort of things are being done, sort of like even outside of that? So, hey, someone wants more reps on whatever it may be. Is there a skills lab? Is there a setup for a skills lab or anything of that nature so residents can kind of get their hands wet even further, especially if they're trying to prep for a case in particular?
Yeah, so we're actually looking at getting into the VR system, the Precision OS system,
Got it.
to use that to supplement our, you know, some of the skills training that gets done for specifically for the junior residents. If there are certain things we have to do, sometimes we'll engage with some of the reps to do some cadaver workshops, stuff like that. But we're going to try to bring VR in, especially in this weird world of COVID where we can't do skills labs. We're struggling with that.
Right. No, that's a great point. There was a question that got asked earlier about, you know, what measures is UC taking to increase, you know, the female complement and recruit female residents in particular. So any thoughts on that?
So we have we have like 30% female faculty. Interestingly, and it's been that way. We have 3.
That's amazing.
Yeah, currently we have 3 female residents. And just to speak a little bit more to the diversity point, we have 1 underrepresented minority resident in the program. So that's something that we know we want to boost sort of diversity in all of those areas. And it's something we are openly talking about and sort of sharing with students and applicants and people around the country as one of our goals. We take care of, like I mentioned earlier, a really diverse patient population, and we want our trainees to be ready for that, and we want to attract a diverse training group. I think we take better care of each other and better care of our patients, right? The more we look like the world around us. So
couldn't agree with you more. I totally
yes.
Well said. I couldn't say it better myself. So that's absolutely amazing. What kinds of things are, you know, obviously lots of great things about this program, and what would you say are things that you are, obviously things are in constant change, as you said earlier. What are things being worked upon to improve at a programmatic level?
Yeah, we look and talk about improvements pretty continuously. So we are making tweaks and small changes on a regular basis. I think one of the big things we tweaked this year was in the first kind of 6 weeks of the core curriculum, we divided the juniors and the seniors into separate educational sessions for them, which was awesome because junior residents have really different educational needs than senior residents do. And so we split them up and did different sessions for them, which, as you can imagine from an education perspective, is double the resources for all of that. So that's it's a really heavy lift. But it's something we're trying to figure out how to do a little bit more broadly across the training program as kind of one tangible piece of all of that. We're constantly tweaking kind of rotation schedules, making sure that experiences are balanced. The residents go to one of our affiliate hospitals in the north suburbs where they see a smaller private community practice type experience. We're trying to find a way to create sort of an elective experience up there for chief residents so that when they get to PGY5 and they know they're going to do this kind of fellowship, they can spend a few months just doing that in a private practice world and seeing what that feels like, which is really different than what practice at the university, right? At what the university feels like.
Right. In terms of like the fellowship aspect of it specifically, is it sort of pretty across the board, especially now that you've added trauma, or does it tend to be a little bit more skewed one direction or the other?
No, it's really variable, and it goes sort of up and down. This past class of chiefs, 3 of 5 of them did arthroplasty fellowships. 1 is doing spine, 1's doing sports. The current PGY4s, or the current chiefs, 1 matched in hand, 1 in spine, 1 in trauma, maybe 2 in hand, and 1 in sports, right? So pretty variable. The current PGY4s, I've got 2 going into sports, 1 into trauma, 1 into arthroplasty, and right. So it's I don't know what
kind of all over,
but it's all across the board. 2 years ago, we had someone do peds, right? And so it's people go into everything.
Got it. No, that's wonderful to hear. A question that gets brought up a lot is, do does the strength of the fellowship really say much that, that programs are matching into? Does that speak to the strength? Should you use that as a surrogate marker for the program itself or quality of the program? And I know it's something that I get asked this a lot. What would you say in that regard?
I mean, people choose fellowships for a huge number of reasons, right? Fellowship is a really, picking a fellowship and matching into a fellowship is really different than matching into a residency. Your goals going into fellowship are much more specific, and you might want to do the fellowship at, St. Joe's Hospital in wherever, West Virginia, because they do this one kind of thing that you have a niche interest in, right? So it's really hard to interpret that as a marker of success. I think I don't know that I would. I think you want to make sure people are matching into fellowships, and it's a fair question to ask. Are people ending up in the fellowships that they want to be in, which is a different question than, are you looking for hoity-toity programs on the list of fellowships?
Right. And yeah, no, it totally makes sense. And my student was asking me this exact question today, which is why I'm bringing it up. And I was saying that for the most part, and for people listening, getting to residency is a really hard part. And it's not to say that getting to fellowship is easy, but it tends to be a little bit easier relative to the residency application process. So the fact that most people are able to get into the fellowships that they want, in part because of just, hey, the variety and the diversity of specialties, as Dr. Balach is alluding to. So I wouldn't use that alone as a way, hey, a program is great because they have all these fellowship matches. No, it's actually interesting to see what kinds of fellowships are they going into, to talk maybe in part about, hey, what kinds of emphases do they have at their program? But the fact that, at least at UC, that they have such a diversity of fellowship matches, obviously just is a testament to the fact that they have obviously a great variety of case pathology they're being presented with, and interactions clinically as well. There's a question that got brought up here. Are there any observership programs available at UC? I'm assuming UC in particular.
Yeah, so we had a couple of virtual experiences. We're in our second of 3. Unfortunately, those have already filled. Outside of that, we unfortunately don't have an opportunity to have additional observerships. We've had a hard time getting through all the HIPAA stuff to open up our conferences and stuff like that. But we are going to host another Q&A, I think next Friday. Sorry, Dr. Ayer, it's going to conflict with this. But it's on it'll be posted on our on the residency Instagram page. So at UChicago Ortho Residency.
And for people listening, I think that's wonderful that you guys, I mean, I've been seeing it all the time, and I don't know if it's a resident or you or a combination of people who are running it. But the fact that, it's absolutely amazing to see all these programs sort of sprouting up with their pages. And the fact that people are so interactive and trying to sort of be available and accessible, no pun intended with Ortho Access, is absolutely amazing. And so I really want to give a lot of kudos to you and the UC folks in particular, because I've, obviously been seeing it, the information, the posts being, floating around. And, it's just wonderful to see that this sort of the outlet of social media, being used in a way to engage with students who may not otherwise know much about the program. So super amazing.
It's been super fun.
Good.
We have a resident team that does it. We have a committee that has some faculty champions, but it's that's run by our residents. They're doing an awesome job.
Good. I'm glad to hear that. What would you say the chemistry is like amongst faculty and residents, and then amongst the residents themselves?
Good that you asked, because I didn't answer that question about my top 3 things about the residency. It's excellent across the board. I think the residents in amongst themselves have great relationships with each other. They like each other professionally and socially. A group of the PGY3s, when they were PGY1s, lived together, which we think helped with that. They were 3 of them were roommates, so that probably helped build some camaraderie. The faculty get along very, very well, are committed to resident education, so it's nice because everyone is sort of aligned in that on that goal. And then likewise, the relationship between the residents and the faculty is really good. They will call about questions related to work or not work or whatever. They are comfortable with us. They ask questions. They want to be taught. They're engaged, like all of those things. I really love spending time with my residents, which is a good thing because I spend a lot of hours a week with them.
That's wonderful to hear. I'm sure I'm sure they're listening too and want to hear that also.
And they can tell you that themselves, right? I would encourage you, if you have the opportunity or you have any questions, like please reach out to our residents and ask those questions for yourself.
I think that's another just sort of important point, is that if you're looking to connect with the program, UC or otherwise, this is a great way in which to do that. Connect with their resident profiles and at least try to set up a meeting. And if it's folks who are accessible like Dr. Balach, then connect with her, connect with others. So you can try to get questions answered that may be weighing on your mind. So you don't have to feel like you're on Lonely Island as you're going through this.
Oh,
so, with that being said, how is there a advising or mentoring program in place sort of for the longitudinally for the for interns and for the rest of the residency and or for medical students in particular at UC?
Yeah, so we don't have a formal mentoring program for the medical students, but they get assigned. They have sort of self-identified mentors who they work with throughout the years, in addition to their medical school assigned advisors. We revamped the residency mentoring program a couple of years ago, and it's been great. Prior in the days of old, like as an intern, you got assigned an individual mentor, and that was your mentor for 5 years. And like, who knows if that worked? Because what do you know as an intern, right? And like, what do we as a program know about you as an intern? Nothing. So we now have a system where the PGY1s and PGY2s have a class mentor. So the 5 PGY1s have one faculty member who mentors them as a group, because they're at a stage in their career where they do well with that. They keep that mentor into their PGY2 year. Through that time, they've gotten to know the department and the people. And then when they're PGY3s, they get to pick an individual mentor, and we pair them then with that individual mentor for the last 3 years of that residency. So often that's someone who aligns with their subspecialty interest or someone with whom they formed a good relationship. Right. So we try to let it sort of fit the needs of the residents as they move through their residency.
Wow, that's absolutely amazing. And I can't thank you enough for having that. And because mentoring is, as we both know, so important. And the advising, and especially right now, it's even that much more important to have that for students, for residents, even for faculty members too. So it's absolutely incredible that you have that. Let me ask you about one of the last questions before I leave you for the night, because I don't want to take too much more of your time on a Friday evening. Is research sort of required, and what sort of projects are students or residents getting involved with, and what kind of resources do you have on the research side, especially knowing that's kind of one of the graduating requirements?
Yeah, so it is required for us, and residents are engaged in a wide variety of projects, again depending on what their interest is, right? We have some residents who enjoy doing basic science work. We have a robust and well-established molecular oncology lab that doesn't necessarily need to do oncology work, but they're set up to do any sort of orthopedic basic science project. We have residents who are engaged in some biomechanics studies with our sports faculty. There are some prospective clinical trials that are going on that the residents are involved in. One of our residents got a grant access to some NBA injury databases, right? So it's doing some work on those things. Obviously, there are retrospective things that are happening, but we have gotten a bunch of sort of institutional research support with coordinators and stuff like that. So our ability to open up prospective clinical trials has increased, and the residents are getting engaged in those, which is super fun and not something that we've had a lot of activity in the past. And that's real orthopedic science, right?
Right. Yeah. Right.
Clinical trial.
I know. One of my students just texted me yesterday, and she's a third year, and she's like, "Oh, could we do this prospective study on da 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 da?" And I was like, "That's a great idea. I'm not sure I'm going to be able to help you with that, but it's a great idea. Let's talk about it further." But no, that's amazing. That's amazing that you have that set up there. There's actually there is a question came up. Do residents who have research at Chicago have opportunities that students could potentially get involved with remotely?
I don't, so that's a hard question to answer because depending on what the work is, if it needs HIPAA training and all of that kind of stuff, we are having a hard time getting non-University of Chicago students involved in research, just because of the logistics, unfortunately, right now. But if there are residents that you know on that list or want to reach out to some of the faculty in a subspecialty area, please feel free to do that. They will let you know if they've got something that they can have you jump in on.
Yeah, that's a great point. And I would also suggest that if you have an idea in particular, you can always run it by either faculty locally or, folks, near you, or even like myself or whatever. And I think that's another way just to say, hey, is there a way to make it happen? Even if it's, whether it's at University of Chicago or otherwise. But, again, there's sometimes there's just like, hey, like some ideas are extremely lofty, but there's more simple things that can be done that can still be purposeful and still be important and contribute to literature. So, certainly important. Well, Dr. Balach, thank you. It's coming on 8 o'clock right now. I want to thank you so much for your time tonight. Do you have any parting words for the students, students applying this year and, students gearing up to apply the next couple of years about UC or any other aspects of the application process?
I mean, I think enjoy the ride. We want to know who you are. This is supposed to be fun and not, and not stressful, even though I know it really is despite us telling you that, but share with us as you apply as much about who you are as a person as you can. I think that lets us see the uniqueness in you, and that is something we really look for.
That's absolutely amazing. And, again, it's been my pleasure and honor to have you on tonight. For folks listening at home, this recording will be available on the OrthoMentor YouTube channel in the next couple of days after I do some editing and finagling with it. Dr. Balach, thank you again for your time tonight. Folks, please look into the University of Chicago program. It sounds amazing. And definitely check out Ortho Access. Obviously, Ortho Access on Twitter is there. If you need the actual contact, email, website, whatever, you can always send me a message and I can get that for you.
Oh, and the Ortho Access website is actually in my Instagram profile. So
there you go. There you go.
Even easier. I just realized that.
There you go. And for those who do follow Ortho Access, yours truly is making a guest appearance next week, helping moderate ankle fractures. And so I'm really looking forward to that. And again, Dr. Balach, thank you for your time again once again.
Thanks so much. This was super fun. Thanks for having me. Good luck.
Of course. Bye. Have a good rest of the night.
Bye.